DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there and welcome to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm really glad you joined us today. We're going to have a great discussion with Dr. Shelley Laughlin, who is an associate clinical professor here at the Veterinary Health Center. We're going to talk about what you need to do to prepare for this calving season, so stay tuned and enjoy the show.
I'm Dennis Tebow. My wife and I, Kathy, are the owners of Wolf Creek Cattle Company. We have grown to approximately 70 bulls.
I'm Reese Arnold. I'm the livestock manager at Wolf Creek Cattle Company. You know, these are not just like normal cattle. These cattle, they're hauled anywhere from, 8 to 10 hours a day across the United States and asked to perform. The Multimin 90 keeps them kind of level. It maintains and balances their system. The stress level's less when, when everything's right and working right, then they're working right.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Shelley, welcome to the show.
Thanks, Dan.
Shelley Laughlin is an associate clinical professor here at the Veterinary Health Center at Kansas State University. I'm not quite used to the names changed
That's
yet.
okay, I'm not
So anyway, Shelley, you're a veterinarian and we've worked together for nearly a decade here at K-State. What are some of the things that you do here for Kansas State, and what kind of your role?
Well, I function very much like a private practitioner here for the Veterinary Health Center, but I always have helpers with me. The senior students come with me on every call that I go out on, and so I'm teaching them just kind of truck side or chute side what it's like to be a veterinarian.
So it's kind of like the school of cosmetology, that you're taking your underlings out that are going to be future practitioners and trying to get them some hands-on experience while teaching them, how to function as a practitioner.
Exactly, yes.
So not all the time are they going. There's going to be times where you're just going to be the one doing it, though.
Sometimes, yeah. Depends on the crew we have for the day.
Well, and calving season, I think, is one of those things when we start to think about training veterinarians, training producers, farm help, things to that nature. But when calving season is coming up and it's upon us, there's a lot that goes into preparing.
There is, and I think being ahead of the game is one of the best things you can be. The better prepared you are, the less oh my gosh, where did I put X, or can somebody go get me Y, the less of that occurs.
So let's talk about some of the things equipment-wise or product-wise that you're going to start assembling here, a month or two before you calves start hitting the ground.
Sure, certainly for us, on our ranch, I start thinking, do we have colostrum in the freezer? If we don't, it's probably a little too late for that, so we need to get some good colostrum replacer. And some of the products are good and some of them aren't. Do we have our calving chains, our handles, our calf jack? Do we have that sort of stuff ready? Is the calving barn clean, as draft proof as we can get it? Do we have heat lamps and things like that ready for that time to come?
So when we talk about colostrum, what are the things, the equipment? We need bottles, nipples, mixer, different things to that nature?
Yep, certainly a esophageal tube feeder is always good
Sure.
to have on hand if you have a calf that doesn't want to suck. And then clean bottles, clean nipples. If they're cracked or the little X in the tip of the nipple is too big, maybe just pitching those and getting a new nipple. If the bottle is dirty or has got some some residue in it, maybe we just pitch that and buy some new stuff if it wasn't cleaned up good the last time we used it. So.
Because the big thing on cleanliness is making sure that we don't get fecal oral contamination and propagate some sort of scours issue within the.
Exactly. Most of these calves that we're treating or that we're giving colostrum to need all the help they can get, and so we don't want to heap any extra stuff on them. So.
Great information. Thanks for watching DocTalk. When we come back from the break, more on preparing for the calving season with Dr. Laughlin. We'll see you here in a minute.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
We started using Multimin about 4 years ago. We started out first in our own cow herd and our own replacement heifer program just to see how it'd work, experiment with it. We don't like to put a new product out there with our clients unless we've tried it ourselves or there's a lot of data behind it that we like. We had really good results with it our first year, really are happy with the way things worked. So we decided to start using our clients, and we have been now for 3 years, and I would say 90 to 95% of our clients use Multimin.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Hi there and welcome back to DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by my friend and colleague, Dr. Shelley Laughlin, who's an associate clinical professor here within the Veterinary Health Center. You also ranch.
We do.
And
Yep.
So you have a full-time job, not only with that, but 2 sets of wonderful twins.
We do have a full plate. We're very blessed.
You are, and so is our family. And so now we're talking about, when we left, we were talking about colostrum, equipment, esophageal tubes, and feeders. And when do you decide to give a calf colostrum?
Yeah, what we want to remember is that we have gut closure almost complete by 24 hours. 90 to 95% closure by 12 hours. So we want to get all of that calf's colostrum requirements into it by 6 hours. So if you kind of backtrack, that's how we tend to think. So most calves should be getting up by 15 to 30 minutes. Most of them should be standing. If they're not up in 2 hours, we need to intervene. And most of the time I probably hedge on the shorter end of that.
Sure.
If they're not getting up, something's wrong. And so we need to intervene and make sure that we either, milk out the cow and get him to suck or tube him, or we use that frozen colostrum or colostrum replacement.
It's amazing how quickly they get up and can suck to get colostrum. You talked a little bit too during the break. We talked about potential, scour vaccine products, oral, parental. What are some of the things that you think about at this point in time?
Certainly, if you're doing parental vaccine, most of that should have occurred 6 to 8 weeks ago in the cow, so that she passes on good immunity in her colostrum. If you're giving a product to the calf, let's say it's first calf heifers or something like that, and you're wanting to boost their calf's immunity, many of those products given orally need to be given prior to the ingestion of any colostrum. And so you want to communicate good with your veterinarian and make sure you've got good instructions on how that product's to be given, so we don't put a $2 or $3 vaccine into them that we've ruined because we just gave colostrum.
Because the colostrum and the passive antibodies can negate or neutralize that product.
Exactly.
Well, so we got the calf on the ground. We've assured the colostrum. Now let's talk about the environment. You talked a little bit about shelter and providing shelter. What are some of the things, preparing that barn?
Yeah, good. If you are barn calving, making sure your calving pens are clean, dry as possible, some fresh straw. It's always best if we can get our heifers to calve on the front end of calving season and the cows after. So just some things like that. If you're pasture calving, then making sure they have good windbreak, they can get those babies out of the wind. If it's 6 foot of snow, we've just got to do something different. Go out there and doze some spots off, some loafing sheds or something to give them a little protection.
Well, I think it's important to know. And, when you start to think about calves, warmth,
Yeah.
hydration, colostrum, and Mother Nature will take care of it.
Yeah, nutrition and warmth are the big things we can do for them off the bat.
Cool. Thanks for watching Doc Talk. We're going to take a break here, and when we come back, more with Dr. Laughlin on preparing for calving season. We'll see you here in a minute.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Hi there and welcome back to Doc Talk. I'm Dr. Dan Thompson, joined by Dr. Shelley Laughlin, and we work here at the College of Veterinary Medicine at Kansas State University. And Dr. Laughlin, we are talking about preparing for calving season. And before we went to break, we'd talk a little bit and just mention about having the heifers calve before the cows. And why is that important?
Well, certainly cows are going to have more pathogens that they can carry along and deposit in the area through fecal or mastitis or whatever. The heifers classically are going to have poor quality colostrum. They're going to have smaller calves usually. And so those calves kind of need a leg up, and they need to get first dibs on the clean environment before those cows come in. Just because the heifers have been exposed to less, exactly, their colostrum isn't as potent, they have probably more issues with dystocia, exactly, could have, and so you're trying to sort out a lot of different things, and being able to focus on those heifers, clean environment for their calves. Right, and you tend to get tired at the end of calving season. I mean, checking 2 or 3 times a night gets old, and those heifers are going to need more observation typically than your cows, and so you're fresh kind of on the front end. By the time you've been at it for 60 or 90 days, you're wearing thin. Not just for the heifers, but also maybe for the people as well. Yeah, exactly. So then let's move into preparing. We hear a lot of things about calving systems or moving animals, and the theory is to have cows calve in an area for 30 days and then you move the animals that have not calved into a new clean environment to continually make a clean environment for these animals to calve in. Thoughts on? Yeah, I think those are good concepts, and they're good concepts to build from. Establishing what will work for you and your labor source, you and your wife, or you and your 3 kids, or whatever it is a totally different subject. And so I think implementing some of those standards are a good idea, but remembering not to be too regimental, I guess, and saying I've got to move every 2 weeks and I've got to have X number of pens, and because in reality that's just not practical for many, many places. Understanding
the theory is important, and when it fits, and you know, it's kind of like everything in a job. You know, as we have time, as we have a chance to progress our system or our farm or our ranch, then things tend to work. But not always are we going to be able to get everything done. So if we're not going to be able to get everything done, you know, we went back to that warm, dry, managing the area that you have.
Yeah, I think just good management and good care of these animals is the best thing. If you get a wet spring in your spring caver operation, then getting those animals to clean, high, dry ground is going to be important, and making sure that they have good, adequate nutrition.
Well, I think you raised some great points, and you know, Yogi Berra has one of my favorite quotes, and it says, "In theory, there's no difference between practice and theory." Yeah. But in practice, there is.
Yeah, it's a little different when you're on the other end. So.
Thanks for watching Doc Talk. We're going to take a break here, and we're going to come back, and we're going to wrap up discussing preparing for the calving season. We're sure glad you joined us.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
You're listening to Ag AM in Kansas. I'm Devin Stewart. There are new meat science research initiatives at K-State's Department of Animal Sciences and Industry. John Gonzalez is a member of the meat research team at Kansas State, and in a recent study they have explored the impact of commonly used feed supplementation programs on important aspects of pork quality.
When you're talking about, I guess, your impact on Mother Earth and that type of thing, sustainability, these are actually good technologies that we're researching because we're being able to, you know, increase the efficiency of these animals on the live side, so the amount of grain they take in, but then we're also being able to increase the amount of sellable products, so we are able to feed more consumers and more people.
With Ag AM in Kansas, I'm Devin Stewart.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
If our local animal agriculture industry disappeared, what else would disappear? The buses that get us to school? The playgrounds and ballparks we go to after school? The books and computers that help us learn and grow? Animal agriculture provides millions of dollars in tax revenue that pay for our school improvements, that pave the foundation that will build our future. A message from U.S. soybean farmers and their checkoff.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by Double D Family Mat Shop. Injured livestock could mean injured profits. Protect yours with no-slip mats from Double D Family Mat Shop.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Shelley Laughlin, and we work here at Kansas State University, and we're talking about preparing for the calving season. And Shelley, one of the things that you know, we get questions about quite a bit is, you know, you're a veterinarian, and I'm going to sit and myself as a producer, I'm going to call you. I'm going to say, Doc, I got a cow that's calving. we've been up all night checking them and things to this nature. And what are some of the things you're going to ask me as a producer that I need to be ready to answer on the phone?
Right. Usually I want to know, how long has she been progressing? Are there any parts of the calf that you can see? We oftentimes worry, is it breech or a backwards calf, in which case you may not see any body parts. So how long has she been down and pushing, or if she hasn't been down and pushing, how long has she been kind of in that stage 1, walking the fence, up, down,
Off by herself,
got a kink in her tail, those sort of things, or you've seen the water bag break. So I want to know those kind of time frame things. And then certainly, have you done anything? Have you tried to pull the calf? Have you been in there to palpate her or anything like that?
So let's talk then. So I say, well, she's been, what are some of the things as far as normal progression when you're talking about has she progressed? About what are some timelines or milestones that I should be thinking about? Or
yeah, usually what I tell our crew is, if you're not getting in her face, so if you can peek through the barn window or through the door and not really disrupt her, flick the lights on and off in the barn, that sort of thing, she ought to make progress every 15 to 20 minutes. So I see the tip of 1 foot, 20 minutes later I ought to see 2 feet or a foot and a nose. Once you get to that stage, the next 20-minute block, I ought to see more of those body parts. Once that stops, we need to intervene. Or if there's no progression made in that time frame, we need
if we check and there's 1 foot exposed and we come back 20, 30 minutes later and it's 1 foot, we need to get her up. And get on it. And then when you're talking about the stage 1, I think that's important. As the cow, the water breaks and she's starting to, I feel funny, I'm getting off by myself and we're going to have this calf, that 10 to 12 hours, so from the time she starts, quite a while, but something that you need to just make sure that you're getting her up and get her to the barn.
Yeah, I think that's the most common thing I hear is, well, she acted like she was going to calve a couple days ago and then never did. And most frequently that's a breech calf or a backwards calf, and it never entered the birth canal, so she never went into stage 2. She never went into that lay down and push and try to have that calf.
Got to keep a close eye on them. How many times a evening do y'all keep track?
We're better at the beginning of calving season. Usually we'll check them about 10 o'clock, and then if something looks like it's going to calve, we'll keep working on that. If not, we'll check midnight, 1 o'clock, and then 4 o'clock in the morning. So.
Appreciate you being on the show.
Not a problem, Dan.
Always great to have you. Thank you for watching the show. Remember, if you want to know more about what Dr. Laughlin and I know here at the College of Veterinary Medicine, you can find us on the web at www.vet.ksu.edu. Remember to always work with your local practitioner. We sure appreciate you watching DocTalk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'll see you down the road.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Multimin 90 is an injectable trace mineral product that contains selenium, copper, manganese, and zinc. One injection provides approximately a 60 to 90 day supply for any treated animal. Trace minerals that are ingested by the animal are absorbed relatively inefficiently from the gut. In addition, other elements in the animal's diet, other nutrients, can interfere with trace mineral absorption from the gut. By injecting a supplemental source of trace mineral, we miss those sources of interference. In other words, injectable trace minerals are absorbed with nearly 100% efficiency and used much more efficiently by the animal. The most critical times for trace mineral nutrition in a breeding cow's life are the period immediately preceding calving and the period immediately preceding breeding. We try to treat mature cows, mature breeding cows, about 60 days before each of those critical time periods starts. Late gestation and early lactation are going to provide the biggest drain on a cow's body reserves for critical trace minerals. We need to replace those before breeding occurs in order to give that female an optimum chance of conceiving and becoming pregnant for the subsequent production year. Now, in our study at Kansas State University, our cows had access to a cell-fed trace mineral product. Our treated cows were injected at preg check in December, and then again approximately 4 weeks before the breeding season began. The result of our research was a 9% greater AI conception rate and a calving distribution that was shifted forward into the calving season approximately 13%. In other words, we had more calves born earlier in the season than we did in untreated cows.